everyone, welcome back. I am Dr. Caroline Vargason, board-certified occulofacial surgeon and the founder and medical director of Nava Face and Eye. We're here at our open house and we have our wonderful volunteer model, Melanie, or Mel, and I work with her at the Salzer Surgery Center. So we're going to be doing a face assessment of her face today. So Mel just shared with me that she's bothered by some lines on her forehead and would just like me to look at her area around her eyes. Anything else specific?
No.
Okay.
Pin me down.
Okay. Well, let's take a look then.
Okay.
And so I will first be looking at your eyelids and your face. I'll take some pictures and then I'll show you what I'm seeing and we'll look together in the mirror. We can make some recommendations. We will skip this part for right now for time purposes, but I do look at everybody who I'm assessing's eyes under the microscope, a very focused exam so that I know how to protect your eyes and keep them safe through any treatments or surgery. And so what I'll do is make some measurements of your eyelids using a light and a ruler. Have you just sit as you are, and you're going to look right towards my nose. Right here. And then I'm going to make some more measurements here with the ruler. I'm going to have you close your eyes for me. I'm going to tug on your right eyebrow. So you'll feel me tug here. Okay, so got everything measured. I'm going to have you raise your eyebrows for me and then relax. And then scrunch your eyebrows together. And then relax. Give me a big smile. And then relax. Okay, so I'm going to take your photos next. And I'm going to have you scoot forward in the chair a little bit to that. And I'm going to put a piece of cardboard behind you. It's a blank piece of cardboard. Pictures. And so you can stay right where you are. This is so we know who's in the photographs. What's your name? Melanie. I'm going to come in front of you. And you're going to just sit as you are with no smile. And you're going to look towards my nose. And then my nose will go away because the camera's coming right between us. And I'm going to take pictures from different angles. And I'm going to have you just keep looking straight ahead as you are. That's perfect. Thank you. And then I'm going to next have you raise your eyebrows again. And then relax. And be angry, front, like push your eyebrows down. Like that. And then relax and give me a big smile. Alright. So, you're all photographed. I'm going to take this away and then I'm going to show you what I see. So now when I get the mirror here, so I'm going to have you hold the mirror where you can see yourself. And let me get something to show you a bit. So, first we'll start with from top to bottom of your face. So when I'm looking at someone's face, I assess the shape and the contours. And so a youthful face has more of a heart shape, whereas as we age in a very predictable way, the face becomes more square. And so that's a look that sometimes people don't like as they have more birthdays and get older and wiser. And so there are certain reasons that happens, and they are very predictable changes. The bony structure of our face changes on the bottom, and the eye socket bones rotate, and all of our tissues sit on top of that. And so that's why these changes happen. And so, starting with your face, you have a nice heart shape, so that's good. And you have these lines on your forehead, and those are from raising your eyebrows for many years being expressive. As we talked about earlier, that can start in your 20s, but it's different for everybody. And so these lines here and here can be relaxed with a neurotoxin and muscle relaxer, and we'll come back to that. So looking around your eyes, when I look at people's eyelids, I am actually looking at three things on the upper eyelids. And so you've seen me do these procedures in the operating room to correct these issues, but the things that I look at are first the eyebrows. So the eyebrows are very important. They're the bottom of your forehead and the top of your eyelid. So they're in the middle, and they're like a curtain rod that holds the eyelid up. And so if the curtain rod is not in the right place, the curtain doesn't work. And so if you look in the, sorry, I keep digressing.
It's okay.
Yeah. So your forehead is actually different in the bone structure in the middle than it is out on the two sides. There's a big chewing muscle on the sides. So if you clench your jaw down, you can feel the muscle up there. What that means, and why I'm talking about it, is for the eyebrows, the tail end of the eyebrow that's sitting over the muscle comes down first over time. And so the tail end of your eyebrow is probably lower than it was 20 or 30 years ago, but it's not to where it's blocking your vision, but it might be some of the heaviness you're feeling in your forehead. And so that can be elevated ever so slightly with a muscle relaxer and neurotoxin injection, and that would be a temporary effect lasting 3 to 4 months, and that would also relax the smile lines or the crow's feet, or a surgical brow lift could be performed to lift that eyebrow up. And so when I'm looking at eyebrow shape and position, I look at the contour of the bones and ideally older pictures or pictures of you when you were younger, so that I know what your eyebrows used to look like. But I can tell just by looking at them that they never had a very high arch, and they just have come down a little bit over time on both sides. And so if you wanted a more permanent lift of those, the surgery could be done to lift them, which you've seen me do. And so the next thing I look at is the upper eyelids here, and I look to see if there's any extra skin. And so you don't have much extra skin, but with your bone structure, the skin tends to fold under the brow bone. So if you did not like the hollow there, it could be filled in with a filler treatment to kind of even and fill out the areas and hollows under the brow bone, and that would actually even out the skin and allow more volume to be distributed across that area. The third thing I look at, which you don't have, but I always look at it, is upper eyelid ptosis, and I'm always correcting ptosis surgery, ptosis this, ptosis that. And so what upper eyelid ptosis is if the lashes come down to actually cover the eye. And so Mel does not have that, so there's no need to do anything about it. And then I always look at the under eye area here, and you have a very smooth transition from your lower eyelid to the cheek. And if that were puffy or not smooth, and there are corrections for that, but that's not something I would recommend for you. So, with all of that said, I would say for you, I would recommend to relax the lines between your eyebrows across your forehead and lift the tail edge of the eyebrow ever so slightly.
Thank you.
You're welcome. Do you have any questions about all that?
Because I tend to talk a lot with my eyes.
Yeah.
And I'm sure that's why I've got these lines heavy across my eyes. So I suppose that's why it's temporary, right? Because I don't know if I'm going to be able to cut that out.
So that's a very interesting, actually, point. And so it depends on the person. So when I relax, if we relax that muscle, which is called the frontalis muscle, it runs from here and it goes up to the hairline. If we relax that, you won't be moving your eyebrows as much. You might not like that, so I usually start light and I don't treat as far down. I was talking a little bit about that earlier, so you can still move your eyebrows. And over time though, your brain, like you tend to raise your right eyebrow more than your left, and that's just, everybody's wired a little bit differently, and that's just how you are. So you may not like that you can't move your eyebrows. I wouldn't freeze them or not allow them to move completely, but over time you might make the expression less. And so if it's expression based, the wrinkles will go away and they might not come back right when the treatment wears off. And that's part of what we would need to learn together about your forehead. And so your brain will actually, you're not thinking about doing any of this. Your brain will actually learn to not raise your eyebrows as much, and you'll just express less as you talk. You might not like that, but it would change on its own. The same kind of thing happens after an eyebrow lift surgery. And so a person who has been raising their eyebrows, or any heavy eyelid surgery, anybody that's been raising their eyebrows for many years, decades, can have lines in their forehead. And after the surgery, they don't need to work as hard to raise whatever was heavy before, and they're still raising their eyebrows. It usually takes about 3 to 4 months for the brain to learn after that type of surgery to relax the eyebrows. And if it doesn't learn, there's ways we can help it along. wrong, and it's not a treatment that needs to be done again and again. The brain can be retrained. So it all depends. Okay.
Very good.
Yeah, so thank you so much
Thank
for
you.
sharing your time with us
For
and
sure.
being available